What criteria should apply when deciding which acute HCV patients should be offered treatment?
When I think about acute hepatitis C, we're thinking about someone who's recently acquired the infection, and therefore they are in that stage where patients may be able to clear the virus on their own. Up to 15 to 30% of individuals can indeed do that, in which case you avoid the necessity of treatment. So the first order of business is to ascertain whether they're going to clear or not, and typically our practice is to follow individuals for at least 12 weeks to try to see if they would achieve that outcome and therefore avoid the necessity of treatment. And then beyond that, I think treatment candidacy depends on a number of factors. Firstly, the number one group tends to be people who may repeat the behavior that resulted in acute hepatitis C infection. That includes both persons who are HIV positive, who engage in sexual behaviors that resulted in infection. And then the second group is, of course, injection drug users, which is a bigger problem in the United States compared to Europe, where the other problem is greater. So therefore, you really need to address that underlying issue. And harm reduction approaches have been very effective to reduce negative behaviors that impact on the health of individuals. And so a comprehensive assessment of the patient who presents with acute hepatitis C includes factors outside of hepatitis C, such as addressing the underlying substance abuse and also thinking about ways to prevent reinfection, which is important for the future. Now, why would you treat such a patient who's at risk for future reinfection events? Well, I think you could flip that question on its head a little bit, because those patients are also at risk for transmitting the virus further within the community and whatnot. So in many ways, persons with acute hepatitis C may fall into a category where they should be prioritized for treatment in order to prevent future transmissions. And so taking all of this into account, in the end, it still is an individualized decision between the patient and the provider to determine the treatment candidacy, whether they can adhere with the medications and whatnot. But individuals are very interested in getting a viral cure. There are many benefits to cure in the long term, including that reduction of transmission and the downstream liver effects. So I am in favor of trying to understand treatment more in this population.